Do you suspect or do you know that you have problems with your hormone balance? Perhaps inflammation is an issue. And did you know that your levels of blood glucose at any given time can actually impact your hormone balance inflammation? Hi, I'm Dr. Patricia Mills, holistic medical doctor with a root cause approach to health, and welcome to the Wild Wisdom Show. Today, we're going to be diving deep into the blood glucose, hormone imbalance, and inflammation connection, covering everything you need to know. Let's get started. What do I mean by blood glucose levels? So, when you eat or drink something that has certain kinds of carbohydrates in them, and there's three different kinds of carbohydrates, two of them, which we're going to cover, have glucose in them. And glucose is a type of simple sugar. And when your body eats or drinks these glucose containing foods, they breaks it down at the level of the gut, and then that glucose is absorbed into the body. And then you get a certain amount of glucose in the blood. We'll call that the blood glucose level. And the thing about blood glucose is that it's not good or bad, but rather when you have a certain amount of blood glucose in a very good Goldilocks range, not too high and not too low, that is really optimal for hormone health and having the least amount of inflammation possible as a result of blood glucose, because glucose in the blood is used by the body for energy. So when you have glucose in the blood, the body senses that glucose, and the pancreas, which is an organ in the body, makes insulin hormone in response to the glucose in the blood. And then the insulin goes into the blood. The insulin knocks on the doors, so to speak, of all of the cells in your tissues, and it tells the cells, listen, there's glucose in the blood. Open up. It's time for you to open up your doors and let that glucose in. And if your body is sensitive to insulin, it's responsive to that insulin, and it allows the insulin to work properly, then the doors to the cells will open, the glucose will go into the cells, and then the cells can use that glucose for fuel, to make energy. So what happens is that when we speak about good glucose balance, is that you're getting enough glucose in the blood from your diet, from what you're eating and drinking, to fuel energy in the body. Your body does use other sources of fuel for energy. So, for example, your body likes to use fat for fuel as well. Your body doesn't really like to use protein as much for fuel. It prefers to use protein for building structure, for making things in the body. But if it's really low on glucose or fat, it will start to use protein for fuel. Now, what happens is that your blood glucose, when it's out of that Goldilocks zone, when it either spikes too high or dips too low, you start to run into problems. Most of us are actually firstly having problems with the glucose spikes because there's a lot of food that's containing glucose that is either obvious, like the simple sugars, like table sugar, or the liquids like Avi syrup, nectars, even things like maple syrup. They're very high in these simple sugars. And even if that table sugar came from something healthy to begin with, like a coconut sugar or a maple sugar, by the time you refine that food so much that you get a powder or liquid out of it, it no longer has the health benefits of that original food. Now it's just that simple sugar. And when you have those foods, what happens is that your blood glucose level will spike very quickly because simple sugars, either in powder or granulated form or in liquid form, are very easily and quickly broken down by the body and absorbed in through the gut. And so you get a very fast, very quick glucose spike. You would see that if you're monitoring your blood glucose with a continuous glucose monitor, for example, which you can wear on your body and senses the glucose levels in your body, or with a finger prick test. And these are devices that, for example, diabetics will use to monitor their glucose. But this problem with daily glucose spikes, which are imbalancing hormones and causing inflammation, happens even in people without diabetes. And I myself was experiencing this issue, which I only discovered when I started to monitor my own blood glucose out of curiosity and interest, and because I was noticing problems with my health and I was trying to understand what was going on with my hormones and inflammation. Now, the problem with a glucose spike is that there's some short-term problems that happen, and then there's some long-term problems that happen. So in the short term, when you have a glucose spike from eating or drinking sources of simple sugars that have a lot of easy to absorb glucose in them, what happens is that when your glucose spikes very, very high, your body responds with making a lot of insulin in response to that high glucose level, that too high glucose level. And so immediately you get a hormonal imbalance in that moment, very short term, where your body is making too much insulin hormone. And the consequence of that is multifactorial. The first consequence is that a lot of that hormone will be floating around in the blood. So then a lot of that high sugar spike will go into the blood tissues, and you will get a very sudden, very quick glucose drop. So as opposed to a nice, slow, steady up in the glucose levels, followed by a nice, slow, steady down with that good amount of insulin hormone production, when you get a very quick, very high spike of glucose, and then you get that quick high spike of insulin, you're going to get a very sudden quick drop in the glucose. And that sudden drop from very high to low causes symptoms. People feel it. Sometimes some people don't feel it, but most people do feel it. And the way they feel it is you get a mood swing. So your mood will dip. Maybe you get irritable, low mood. Your energy will crash. So you'll feel low energy. People will often particularly feel that between breakfast and lunch, or between lunch and dinner. You're going to get hunger because your body's going to sense that your glucose levels are dropping low. So even though you may have recently eaten something, within an hour or so, you're going to get a hunger craving, which you shouldn't get if you ate or drank something that has good glucose balance results, which we're going to talk about how to do that. Now you have that insulin imbalance, which also causes the cortisol imbalance. Cortisol is the stress hormone. And when that blood glucose dips too low, some people even get to the point where they're hypoglycemic, their blood glucose levels are too low. That causes a stress response in the body, and the body will release cortisol hormone in response to that. So now you have a cortisol hormone imbalance that's happening. You're going to feel the symptoms of hypoglycemia, and many of us will then reach for another food to feel better. And that food usually has too much glucose as well. And now you're on a roller coaster of the glucose going too high, and then the insulin hormone going too high, and the glucose dropping too low. You get your symptoms, and the vicious cycle continues. In the short term, you also get inflammation because too much glucose in the blood is very inflammatory. Glucose is actually very damaging to the body when it's present in too high amounts. So it starts to stick to things. It'll stick to blood vessels, the inside of your blood vessels. It'll stick to things like your red blood cells. And if this happens over time, you can actually detect that on blood work using what's called the hemoglobin A1C, which your doctor can order for you. And that tells you how much of that red blood cell is covered in glucose. And the thing is that when tissues have glucose sticking to them, that tissue function now is decreased. So we're going to talk about what are the long-term consequences of having glucose sticking to things. Also, that high cortisol response is inflammatory. So now you have two reasons for being inflamed in the moment of having that too high glucose spike. You get the tissue damage. And over time, you're also going to get more fat storage, because another function that insulin has as a hormone is it sends the signal to store fat, because it's saying to the body, listen, we've got a lot of glucose floating in the blood. You don't need to use fat for fuel. So don't touch those fat stores that we have lying around. Let's just use the glucose and we can save the fat for later. But if you're continuously spiking your insulin hormone, you're going to be continuously not using that fat storage, and you're going to slowly over time gain weight. Now, the interesting thing is that part is a bit genetically determined. In some people, genetically, they're less disposed to put on fat in response to this, which actually can be detrimental, because sometimes gaining weight is the indicator that you need to do something differently about your health. However, if you're not gaining weight, if you're looking okay on the outside, but inside you're getting the hormone imbalance, you're getting the inflammation, and you're getting the tissue damage, you may not know until it's too late. And here are some of the long-term consequences. So the long-term consequences of getting these daily glucose spikes And what I can tell you is that even though you may think you're eating a healthy diet, you're probably experiencing these spikes like I did, and like many of the people I work with in my health promotion programs, where we monitor blood glucose as part of the program. And it's surprising to see how most people are getting these daily spikes. And I'm going to tell you how. But what happens is over time, these daily spikes will lead to other hormone imbalances. So, imbalances in thyroid hormone, estrogen, progesterone, and testosterone. Over time, your body will become resistant to insulin hormone. What I mean by resistant is that the body is no longer responding to insulin in a way that it did when it was in a healthier state. So instead of insulin being effective in getting the tissues to open up all of those cells, now the cells are not responding to the insulin like it used to. Similar to if you were to take a person and start shouting into their ear at a very loud volume for long periods of time, that person might slowly become deaf. They become resistant to sound. So it's a similar thing that's happening with the insulin hormone when your tissues are becoming resistant to that hormone. And the effect of that is that you start not getting that glucose into the tissues effectively. So now the tissues are having a hard time getting access to glucose for energy, but they're also not very good at burning fat for fuel because they've gone for years by this point of not being able to use the fat because of that excess insulin hormone telling the body don't use fat for fuel. So now you have what's called metabolic inflexibility, where you're good at burning glucose, but you're not good at burning fat for fuel. So your tissues enter into an energy crisis where they're not getting enough energy production to do their functions properly. So in the brain, that can affect how your brain works. So brain fog, problems with memory, problems with focus, attention, concentration, and problem solving. It can affect, again, your thyroid, your ovaries, your testes, your skin, your gut, your joints, your muscles. Insulin resistance can show up in many different tissues. If it shows up in your muscles, you'll eventually be diagnosed with prediabetes and then diabetes, because now the muscles, which are big users of glucose, can't get as much access to that glucose. The glucose level starts to build up in the blood versus going into the tissues. If you were to do a fasting blood glucose first thing in the morning, that glucose level would be higher, which is not a good thing, because not only does that show that you're developing insulin resistance, it also means that you've got more glucose floating around in the blood, which is damaging the tissues from the inside. So you're getting more inflammation, more tissue damage over time, plus or minus a diagnosis of diabetes. Now, some people, they don't actually get diabetes because they're genetically not getting that muscle issue. They might get insulin resistance instead in the brain. And when you get insulin resistance in the brain, that can lead to diagnoses like Alzheimer's disease. And certain kinds of Alzheimer's disease are now being called type 3 diabetes, where it's diabetes of the brain. In other words, the brain is insulin resistant. It cannot get access to glucose for fuel, and you start having problems with your memory, your concentration, your focus, your problem solving, and everything that happens with respect to things like dementia and Alzheimer's. Because you're getting that tissue damage from the inside from the glucose and inflammation, you increase your risk of cancer, heart attacks, and strokes, and other neurological conditions. In fact, if you look up any chronic disease and see its connection to insulin resistance, you will find it, including menstrual disorders like polycystic ovarian syndrome, fibroids, endometriosis, infertility, all through to perimenopausal issues and menopausal issues, worsening problems with osteoporosis, mood, and all of the consequences that can happen with menopause, but don't need to occur if you're managing things like your glucose levels. And what's very, very important to understand is that these conditions can be prevented and even in some cases reversed despite your genetic predisposition when you start to pay attention to and monitor and improve your blood glucose regulation. So this is important. Just because you have a family history of diabetes, of cancer, of all of these conditions that I've mentioned, doesn't mean you're destined to get it. What it does mean is that you have to be particularly attentive to blood glucose regulation, because while genetics can load the gun, things like blood glucose regulation pull the trigger. But the good news is that when the issue is either in prevention phase, mild to moderate stages, it is reversible. We know type 2 diabetes and Alzheimer's in that mild to moderate stage can be reversed with lifestyle strategies like blood glucose regulation. But when it gets very, very severe, when you're end stage, then it's too late. There is a tipping point. So it's important to pay attention now. And I'm going to teach you how to keep your blood glucose in check. And what you have to understand is that number one, you have to choose foods that release glucose slowly. So remember, I told you that there were 3 different kinds of carbohydrates. Type number 1 is your simple sugars, which I covered, your table sugars, no matter where they come from, your simple syrups and your liquids that are very, very refined sources of sugar, including glucose. Then you have your type 2 carbohydrates, which are your starches. And starch is basically many glucose chains linked together. And so you find starch in things like whole grains, in vegetables that are high in starch, like carrots and potatoes and beets. You find them in beans, so lentils, chickpeas, black beans, kidney beans. They are all very high in starch, and they are very healthy foods because they also have the 3rd type of carbohydrate, which is fiber. Fiber is a carbohydrate that has no glucose. It has hemicellulose, cellulose, and pectin, and these are the walls of plants, the walls of the cells in plants. And what's cool about fiber is that unlike simple sugars and starch, it does not get broken down into glucose in the gut, so you don't get any kind of glucose spike by eating foods that are high in fiber. And the foods that are very high in fiber and low in starch are things like high fiber vegetables such as broccoli, cauliflower, cabbage, kale, kohlrabi, turnips. Those kinds of foods will not cause a glucose spike. And in fact, they can be used as buffers to improve the glucose spikes that you can get even with starchy foods. So while beans, for example, are a very healthy food, if you just eat a cup of beans, you're going to get a big glucose spike over time because it has a lot of starch. So you're going to have to learn how to do things like balance your meals in order to improve your glucose balance. And so if I want to eat a high starch food like rice, beans, quinoa, teff, millet, any kind of high starch vegetable like potatoes, I'm going to have to balance that food with high fiber foods like vegetables that are high in fiber, as I mentioned before, as well as a good serving of protein and healthy fats. Because when you balance your high starch foods with these low starch, high fiber, protein, and healthy fat foods, you get a much better glucose response. Now, of course, in order to balance your meals and your snacks, you have to avoid sugary drinks and snacks. And this is a problem, is that a lot of us are actually unknowingly taking in the simple sugars, the type 1 carbohydrates mentioned before, through what we think are healthy snacks because they're labeled as organic, natural, gluten-free, dairy-free, low sugar, whole wheat, baked. But unfortunately, if you actually read the ingredient list, most of the ingredients will be some kind of simple sugar. And the food industry has more than 56 different names for sugar that they can sneakily put in those foods and put in the ingredient list. And if you're not aware of how to read an ingredient list on a packaged food in order to determine if your favorite protein bar or granola or gluten-free, dairy-free, low-fat product is actually full of simple sugars that are causing these issues with blood glucose balance, you're going to be unknowingly sabotaging your health. And years from now, you're going to be wondering, why do I have these health concerns? And you're never going to clue into the fact that it was all of these packaged foods labeled, we can call them greenwashed as healthy, but in fact, we're damaging your health. So if you are going to eat or drink something sugary, for example, like some kind of treat or a cake or a cookie or a pastry, your granola bar, for example, then you're going to want to definitely use some glucose buffers and things that buffer the glucose, that slow down the entry of the glucose into the body to prevent that glucose spike, include, again, high fiber vegetables, protein, healthy fats, vinegar, like apple cider vinegar or any kind of vinegar really, because it's the acetic acid in vinegar that helps slow down that glucose absorption. Movement, so if you eat something high in sugar or high in starch, if you then immediately go for a walk or do some squats or clean the house or do vacuuming or whatever it is that involves activation of your muscles, which love to suck up glucose, That's going to help improve your glucose response to that meal. And the long-term strategy is to exercise, but a specific kind of exercise, which is strength training. If you increase the size of your muscles, you're going to improve your muscles' ability to use that glucose so that you can tolerate more glucose with your meal, so you can have a bigger serving of sourdough bread or oats or pizza or pasta in order to tolerate that bigger serving with bigger muscles. So it's not that you want to get very bulky, huge muscles, but you want to work on getting that muscle tone and that muscle strength with a bit more increased muscle size so that you can tolerate more glucose in your diet. And also, you want to be sure you're mindful of portion sizes. So, yes, a bowl of oats can be very healthy, but if you have a big bowl of oats, that could be too much starch and your body can tolerate in that moment because of that portion. And even a bowl of oats needs to be buffered by things like fiber in vegetables, protein, and healthy fats in order to improve that glucose response. That was actually the thing that was imbalancing my glucose when I started glucose monitoring, which was my bowl of oats in the morning was causing a massive glucose spike in the morning. And what your glucose does first thing in the morning will determine how your blood glucose levels react to every single meal afterwards. So the first meal of the day, your breakfast, breaking your fast, is the most important meal to affect your glucose balance through the rest of the day. I can give you the same lunch and dinner, but if I improve your glucose response to breakfast, you will have a better and improved glucose response to lunch, dinner, and every snack in between. So again, balancing your meals, getting your glucose buffers, looking at your portion sizes, minimizing the hidden and obvious sugars will all be very important. So that's dietary. Now, the next tip is to get enough sleep. When you sleep poorly, your blood glucose control is worse the next day, which is one of the reasons why after a poor night's sleep, we get problems with hunger and low energy and irritability. A lot of it has to do with how it's affecting our glucose levels the next day just from poor sleep. You also want to manage stress because just how insulin can imbalance cortisol, cortisol can imbalance insulin. And you can actually get changes in your glucose levels just from being stressed out. So learning techniques like breath work, meditation, taking relaxation breaks through the day in order to lower your stress levels can all be very important. This aspect of managing blood glucose is very surprising to some people, which is protecting gut health. Gut health has been shown to affect how your body breaks down and absorbs glucose. They've done twin studies where they take twins, genetically identical twins, they give them the same meal, they measure their glucose response to that meal, and it differs between both twins because of differences in their gut health. So this is really important to be aware of, is that for some people, they can eat, for example, half a banana and have really good glucose control, and other people, it causes a massive spike. So the reality is that using these strategies can be very effective, but in the end, you may want to consider monitoring your blood glucose as part of a health promotion, as part of improving your hormone health and lowering your inflammation, especially if you're noticing that you're not getting the results that you want. Now, you can see if you're listening to this on a podcast, I'm showing this on my YouTube video. I'm wearing the glucose monitor right now. I do this once a year because our ability to handle glucose, again, changes with our gut health status, it changes with our hormone status, it changes with your age. So as your estrogen goes down into menopause and beyond, you do get changes in your ability to metabolize and use your glucose. I like to do this once a year, and I usually time this with when I'm offering my women's health promotion program, Body Wisdom, where as a group, we all monitor our glucose, and I teach women how to interpret the glucose in terms of determining how your insulin hormone is behaving and are you developing insulin resistance or not. Because while glucose monitoring will tell you how your glucose is doing, it doesn't measure the insulin hormone. And that's a very important aspect, but there are certain patterns that you see on your glucose monitor that will give you an indication as to how your hormone health is doing in terms of your insulin sensitivity or resistance. And that can guide you in terms of what it is that you need to do specifically to improve that. So I'm going to be putting some resources in the caption, including the link to Body Wisdom program. If you're catching this in time to register and participate, I usually offer this in the end of January, February for 4 months. Don't worry if you've missed it. You can put yourself on the wait list. People on the wait list get first dibs. This program fills up fast, so be sure to register if you're at all interested. And I look forward to hearing your comments in the captions. If you're listening to this on the podcast, pop over to my YouTube channel, Dr. Patricia Mills, MD. That's where you can put in your comments to ask me questions. If you enjoyed this episode, please save it and subscribe to the channel. That's the best way to support the show. And also the best way to support your loved ones is to share this episode with them. Sharing is caring, and you never know when someone's going to benefit from this wild wisdom. I hope you have a wonderful rest of your day, evening, or night, depending on when you catch this, and I'll see you next time. Bye now.